Hi guys, Heidi Cooper here, functional medicine practitioner, licensed esthetician from SkinSide Out. So today I want to share some really basic lab work that I like to look at for any clients that come to see me. Doesn't matter if they're coming to me for acne or anti-aging. I'm just gonna give a basic list of what I like to see that gives me a bigger picture of what is really going on with the client and how best to address from the outside in and from the inside out their skin challenges and what they're wanting to address and what really needs to be addressed for optimal skin health. And we know it's really for optimal health in general, but when we're healthy from the inside out, so is our skin. So here is the list. So first of all, I want to see a complete metabolic panel in a CBC with differential. It has to be with differential to kind of get a good idea of what's going on, if there are any infections, acute or chronic, that the body's dealing with. All of that gives us some really great information. We can even see if there are anemias going on or different challenges from that standpoint that we can look at from the CMP, the complete metabolic panel, and the CBC with differential. So then I also like to see fasting glucose and hemoglobin A1C. So you've heard me talk before about how glucose levels can really affect what's going on with the skin. We talked about that recently with insulin and acne. So we like to kind of see what's going on there as well. And then moving into some of the hormones, I like to see estrogen, progesterone, testosterone, pregnenolone, and DHEA. Those are precursors for some of those other hormones. So sometimes if those are deficient, we can kind of take a look at those things and see what's going on there. I like to see a full thyroid panel. So not just the typical TSH or T4, we kind of like to see what's going on with T3 and what the conversion looks like and how that's happening there. So a full thyroid panel is really important too. And I also like to see something called a TPO, which is a thyroid peroxidase, which is antibodies for thyroid. So if there are any autoimmune situations going on. And that's also something we can see sometimes when we're looking at that CBC with differential too. It can kind of give us an idea if there's some sort of active autoimmune flare. And so I also like to see the CRP, so C-reactive protein, for inflammatory markers. That can be really helpful as well. And then vitamin D levels. Those vitamin D levels are really critical because vitamin D is actually a hormone and it can affect a lot of other things that are going on with the body in general. So that's just kind of a basic overview of what I like to see. You know, we can kind of look at that lab work and see if there are things that we need to dig a little bit deeper and do a little more extensive lab work and see maybe what's really going on. But it really gives us a bird's eye view of how the best way for us to really treat from the inside out what's going on with the skin and then the outside in, and really address what's going on with the entire person and make sure that our plan is the most effective. So hope that was some helpful information for you. If it was, please like and share this video. If you have any questions about any of these labs, please feel free to reach out. Health and happiness. Have a super fantastic day. Thanks so much.